Good day, everyone. Today, we will continue with our presentation. As we began earlier, I introduced you to the topic of diabetes, and we covered the three main types of diabetes. That's the type 1, type 2, and the gestational diabetes. Today, we will focus on the signs and symptoms of diabetes. When people refer to the classical signs and symptoms of diabetes mellitus, they are usually describing a group of features that appears when the blood glucose becomes significantly elevated. These symptoms are not random. They follow a clear biological pattern known as the 3Ps. They follow a clear biological pattern. So we have the 3Ps so far as the signs and symptoms of diabetes is concerned. So the first P is polyuria, that's frequent urination. When the blood sugar rises, the kidney tries to remove excess glucose through urination. Glucose pulls water along with it, so the person urinates more often than normal, even waking up the person multiple times at night to urinate. So we can also talk of the second P as the polydipsia, that's excessive thirst. Because the body is losing a lot of water through urination, dehydration is always developed. This triggers an intense thirst, so the person keeps drinking water but may still feel thirsty. And we can also talk of the last P as the polyphagia, that's excessive hunger. Even though there is plenty of glucose in the body cells cannot make use of it properly due to the lack of insulin or insulin resistance. The body thinks it is starving. So that's how the body thinks. The body always thinks it is starving. So appetite is always increased. Other common symptoms beyond the 3Ps can also manifest during diabetes mellitus. So we can also talk of unexplained weight loss. This is more common in type 1 diabetes. Since the body cannot make use of the glucose, it starts breaking down the body fat and muscles for energy. So we can also talk of fatigue or tiredness. Cells are not getting enough usable energy, so the person feels weak and tired most of the time. We can also talk of blurred vision. High blood sugar causes fluid shift in the eye lens, affecting focus and leading to temporary vision loss. We can also talk of slow wound healing. Cut or saw takes very longer time to heal because of high glucose level affecting circulation and immune system functions. Frequent infections, examples like skin infection, urinary tract infection, fungal infection, especially in the genital area. Then we can also talk of some severe or late symptoms associated with the diabetes if not treated or controlled well. So more serious symptoms may develop. We can talk of nausea and vomiting, abdominal pain, deep or rapid breathing. We can also talk of confusion or unconsciousness. This may indicate complications like diabetes ketoacidosis. I will end my video here so far as the signs and symptoms of diabetes is concerned, and we will look forward to the next steps so far as the presentation is also concerned. Kindly like my video and send it to others for them to also have the benefit of this video. Thank you very much. We shall meet in our next episode.